The wedding season is on and all of us love flaunting our saris, don't we? But then we see the back rolls which make our look underconfident and unsightly. So what do we do? Here's the solution. Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Cosmetic Clinic, Saket. Today we're going to be talking about a very specific area of liposuction, the back. So bra rolls are a very common concern among women who find them very unsightly and they feel very underconfident in wearing certain dresses because of those unsightly bulges coming out. So let's understand today as to how these can be tackled. Back fat is a little different from fat in other areas of the body because it's very dense, it's very fibrous and is more stubborn to treatment. It also usually does not respond to diet and exercise like other areas of our body does. So what is the reason this happens? Back fat is dense, it's very rough to treat and requires specific treatments like liposuction, and at that too, it requires advanced forms of liposuction like vaso liposuction, which utilizes ultrasonic waves to break down the fat and thereby makes it easier to take it out. Also, the back skin is not as elastic as the other areas of the body. So, vaso liposuction not only helps with removal of the fat, but also helps in tightening the skin, thereby giving a nice contoured look to the back. There are certain reasons why back fat develops, which may be other than the normal reasons like obesity. One of them is hormonal changes which can occur in the body due to certain diseases. There are certain conditions like Cushing's syndrome where the steroids in the body increase and that leads to these bulges. Also, sometimes the use of certain medications can lead to stubborn back fat. There is again a very specific kind of back fat called the buffalo hump, which is found just below the nape of the neck, and this is again very stubborn and very resistant and usually is again in response to these hormonal changes or medication, or in certain cases some abnormalities of the spine in that area, which can lead to these unsightly collection of fat. So whatever be the reason, the best form of liposuction to deal with back fat is vaso liposuction. The second thing which is of importance is that back is an area which is very prone to the formation of something called seromas. So what is seroma? Seroma is basically a collection of fluid which happens after a liposuction and occurs more commonly in areas like the back. Thereby, two things which we need to remember when considering a back liposuction are: one, it should be a vaso liposuction; two, it is very important to follow up the liposuction with lymphatic massages which help the seromas to either not to accumulate or to get drained if at all they happen. Again, what is again important is that we need to wear compression garments just like other forms of liposuction, but it becomes even more important in a back liposuction so that you get a good result and you don't see any irregularities in the skin surface. Back liposuction is usually done under general anesthesia. It is a procedure which takes about 1 to 2 hours depending upon the kind of fat you have and the amount of fat you have. It's a daycare procedure and you have to follow more or less the same instructions like any other liposuction as to avoidance of exercise, not lifting weights for a period of 4 to 6 weeks. Results, they will appear within about 1 to 2 months and they stay lifelong if your weight remains stable. Obviously, fluctuations in weight or intake of medications like steroids are to be avoided once you've got a back liposuction done. Overall, with the use of proper techniques and proper post-operative care, liposuction is very successful in giving you a very nicely contoured back. So this in brief is about back liposuction. If you have any further queries regarding this particular topic, please feel free to reach out to us. Also, if you found this video informative, please like, share and subscribe to our channel for more such informative videos. Thank you.